if you could go back and knowing now what you know, 20 years ago when you first started out, what would you do different in terms of practice management? What are those big, big pearls that have really helped your practice and you personally in terms of having balance with life and having just a real successful career? What are some other things that you'd like to give some of these young doctors that are listening to this program?
So, if I were to talk about a few things, I think the most important thing for me was finding the right location. You hear a lot of stories. You hear about podiatrists eating their young and a variety of different things, and I don't want to go that far. But I took a job. I took a job. My first. It was funny. I was just cleaning out my file cabinet. I knew that I wanted to come to Tennessee, and I wrote an email to every. I wrote not an email. I wrote a handwritten letter to every practicing podiatrist in the state of Tennessee.
Yeah.
Every practicing podiatrist. There were only 60 something at the time. You know, and I think that I think choosing a location that you want to be in, demographically knowing what's going on. I coming from graduating from my residency in New York, there were a lot of podiatrists in New York. I knew that people were shuttling from borough to borough, and it wasn't easy even back then. Imagine what it is now where there's more established practices. But there were only 60 podiatrists in Tennessee when I came here.
Wow.
We're now almost up to 200. Which again, in the scheme of things, is not a lot. I think that the area is wide open. Interesting, even being out here in Montana, I've Googled and looked at the different practices, but I think if you find a place that you think you can be happy, and if it has something to offer you, I think that's really the first thing, because who wants to be working at a job, living in a place that they're not happy in? So, I ended up in a job that wasn't right for me. It was in Tennessee, and I got lucky and found another job, and I transitioned into Chattanooga. I think the big difference, or the thing that I would recommend to everybody, is I think everybody is so, as they should be, enthralled in their education. I think that the time now, when you're in your training and early on, you have to go to as many practice management or non-academic programs as possible.
Yeah.
I mean, I will tell you that, in my residency, I spent extra time on my own in doctors' offices and learning things. And, I started learning. I mean, I can share with you that what triggered my learning curve very, very quickly was my practice that I was working for got the largest audit in the state of Tennessee from Medicare. You probably won't even know the codes because they don't exist anymore, but it was nail care codes, and we got asked for $350,000 back by Medicare. I was Kevin West's first big client. Kevin West is now the guru for Medicare audits for PICA. And so we won. We did really, really well. We ended up having a small fine that we paid, minimal compared to what they asked for. In fact, they had to give us money back with interest because we paid it off before it was settled. But it really taught me to truly learn how to bill for what I actually do and not try and cheat the system. Yeah. Don't be creative. I mean, there are still people who are billing in Austin and in Aiken, and that's considered unbundling. So learning how to bill appropriately was critical for me. Learning how to document appropriately was critical for me. And then, every time I went to a conference, I always wanted to bring back one new pearl. I didn't get overwhelmed with everything.
Yeah.
I wanted to learn how to do one thing and bring back that one thing. I remember when I first started doing DME wound care. I mean, it was very novel. I went to school. I was residents with Josh White, who started Safe Step. So he got me started in shoes, and periodically, I just started implementing one thing at a time and doing it well, and not overwhelming my staff.
Yeah.
I mean, and I also learned. So what I did was, as my practice grew. At one point, Don, we had 68 over-the-counter products in the office. And I said to myself, you know what? I want to provide services, but I just can't have stuff lying around. So what I did was I went and ran a report, and I looked at the top 25 products that all of the doctors used. And it turns out that there were 20 that were really used a lot. So I told each doctor, we're ordering these core 20 products, and you can choose 5 of what you want, because I wasn't going to have inventory lying all over the place.
Yep.
You know, the other thing for me was I was very open. So my physicians that worked for me, we did a quarterly financial review, and every year they got offered partnership. Nobody ever exercised that option before I sold my practice. But I had an open book policy. And I'll be honest with you, at the beginning when I was just learning, things were turned upside down. But everybody, they knew what I made. I didn't hide anything. It didn't matter that I was the owner. I needed them to know exactly what the practice was doing, because I think that it's important that I be open. I didn't want them to think, well, I'm working my ass off and he's not doing anything. I mean, and then, the other thing that I think was critical for me, and it's what I did when I even started hiring people, was clinical protocols. Very, very early on, and I'm going to say something, and you might, people cringe sometimes, but you go to a McDonald's, and if you buy a Big Mac in Los Angeles, in Hong Kong, New York City, or Duluth, Georgia, it's 2 beef patty, special sauce, lettuce, cheese, pickles, onions on a sesame seed bun. That's the protocol. And I would say that the majority of what we do is of patients' conditions is going to be treated with clinical protocols. I mean, if you think about it now, so I started doing this 20 years ago, and I'm not going to say I was the only one. There were other people doing this, and everybody looked at us like we were crazy or we're telling people how to practice. Well, what happened was, if you think about what's happening in medicine, up until recently, reimbursement was based on claims data. They didn't have outcomes data.
Mm-hmm.
They didn't know what was going on. Why do you think everybody has a registry now? Why do you think there's now global payments? Why do you think there's population health, where you're trying to manage illnesses? They're looking for outcomes-based information, and the only way you can do that is just like in a clinical trial, following a protocol. I mean, look, I don't mean to be, and a lot of people that have done really well, outside the box. I mean, I have to tell you that, some of the things with all the regenerative medicines that are coming on right now, there are some things that are covered, some things that are not covered. But, we all know, look, I grew up in it's interesting story. When I came to Chattanooga, there was an orthopedic surgeon there. I don't want to mention his name, but he was the initial FDA tester for the first Shockwave with Oscitron.
Mm-hmm.
And he was in Chattanooga. And at the time, he was anti-podiatry with steroid injections, and you didn't do any of that stuff because that was bad. Well, once the FDA approved it and they started putting out Oscitron machines, Oscitron actually did small investments. Who do you think was the first person this big orthopedic surgeon came to invest in a machine in Chattanooga?
You.
Right, because I had 6 clinics with a lot of heel pain. And guess what? When Blue Cross Blue Shield said we're going to do a special policy, and in order to cover shockwave therapy by insurance, you have to have 4 conservative treatments, one of which includes a steroid injection. What do you think this orthopedic surgeon did?
Came to you.
No, he did steroid injections.
Then he started to do them.
Correct. So all I'm saying is that if I would have look, I don't think there's a cookie cutter thing for somebody that comes in for a trimal fracture. I'm not saying that kind of stuff, trauma, is going to be, but on the patients that we see in the office, like if you have a large wound care practice, and I'm not even talking about the actual wound care, Your assessment should be methodical every time that patient comes in. That first visit should be a vascular evaluation, a neurological evaluation, a biomechanical evaluation. Do you know how many times that we miss offloading patients because of the biomechanics but your protocol and how you see a patient should be consistent. So if I were to tell young members anything, I would say choose a place you like, where you think you can either raise a family or be successful. And success is your own definition. If you want to work 30 hours a week and go hiking in the Rocky Mountains, then that's what you want to do. I would make sure that you learn correct billing and coding techniques. I would understand billing and coding techniques. I would develop clinical protocols that work for you based on the people that you trained with and based on your clinical outcomes with your patients. You're going to make changes on everything that you do. And then I'm also going to tell you, on a personal note, even when I owned my practice, the one time that I wasn't perfect, when I say perfect, that I might have spent more money, is I actually only support companies that support my profession. So I don't buy from companies that don't support my profession.
That's a good point.
It's just something that was important for me. And so again, I think that the other thing that probably the last thing that I would tell you is, when I used to hire doctors out of school, out of their residency, and things have changed, and sometimes they're able to get licensed in advance. My most successful physicians, and I don't mean medically, because everybody's well trained. My most successful physicians, the physicians that, we are now in a world where we are practicing the business of medicine. Yes. Whether we want to agree it or not, medicine is a business. And, if you don't, it doesn't mean you're not philanthropic. It doesn't mean you're not caring. It doesn't mean you're not giving. It's a business. And so what I would tell you is that I used to, the ones that were most successful, I used to have when I hired somebody, most of the time back in the day for me, they didn't have their license or they hadn't been credentialed. They weren't on the insurance plans. So I told them, I said, listen, here's the deal. I'm going to hire you from, day one. And I told them this, and I said, listen, I'm going to pay you 50% of your salary for till you get credentialed and you get on the plans. You don't have to do anything. You just have to watch me. I want you to see how I treat patients. I want you to see how I work with my patients, how I ingratiate my patients. I was told by somebody a long time ago, it's not whether you spend 30 minutes or 30 seconds with a patient, but it's how you treat them in that time that you're with them.
How you make them feel.
Correct. That's 100% correct. So, and then as soon as they're comfortable and trained on their own, off they go. I put them in a location, and they all lived to do very, very well. And I can tell you that I never had a doctor that never achieved a bonus in their first year of joining my practice. So I did an orientation time at the beginning, and some people are like, "Well, that sucks. That's shitty. You're taking advantage of me." I didn't look at it as taking an advantage, and I think that my goal was to give them the best tools that they could have to go out and make a good living.
Now tell me, Ira, how come more people don't know about TaylorMed? Is it a newer company? Is there a lot of competition?
So you can go out there, Don, and if you look at when you're buying, I mean, when I started practicing, I can't speak for how you do your ordering in your office now, but to be honest with you, we didn't have the internet, and we got all the catalogs, and we would look at every catalog, and we would buy one thing from here, two things from here, three things from here, and it really wasn't time efficient. And so what I've learned is that, with the exception of some ostriches that show up, if you look at aggregate costs as opposed to looking at every line item, you're going to save time. And when you save time, you actually make more money. So what we do at Taylor, and this was started by me and Jeff DeSantis, who's the next APMA president, in 2016. Currently, we've saved podiatric physicians $4.6 million in actual cost, hard cost of spending. everybody gets a rebate, and we've donated $50,000 in student scholarships, all before we've given any distribution to our investors. Our goal is to promote and help podiatry. We are looking at a variety of different things, and so what we do is, we go out there, and the way Taylor is set up is that the guy that has one practice or the guy that has 30 practices, we don't want the guy with one practice to get screwed, because what happens is, based on your buying power, it's very different. So we are what's called an aggregator. So I can tell you there are certain areas that I know that my prices cannot be beat. And there are other areas where, and there are other areas where I say, you know what, it's okay. But what people don't realize, so I'm going to ask you a question. Do you do credit card processing in your office?
Yeah, it's through the EMR that we use. Yeah.
I know, but how much do you pay? Do you know what percentage?
No clue.
Why don't you find out? Because I guarantee you're paying 2.5 or more. I have it for 0.99% across the board.
Okay.
I've saved people 20, 30, 40. Actually, to be honest with you, I am negotiating with some of the state societies for dues collection, as well as in discussions, nothing with even APMA, we can save the $250,000. Nothing is finalized, but those are the type of things that we can do at Taylor. It's not just getting medical supplies, and we need to spread the word. I want people to know that we're giving money back to the community. Yeah. None of the other companies do that.
Or how is
it? Well, we started in 2016.
So it's fairly new.
What?
It's fairly new then.
Right. I mean, look, if you look at the competitors for me out there, like, for example, where do you buy your medical supplies?
Like everyone else, I think we do a little bit through Henry Schein. We do through More Medical, and then what's that one that delivers to all the hospitals? Medline.
Yeah. So Medline is Taylor. If you're not linked to Taylor, you're paying more money for Medline than you would with me. We have a 20% discount. Mm-hmm. What I'm telling you is, and so there are the difference between us. So I'm what's called a GPO, which is a group purchasing organization. We get paid by the vendors. Okay. We don't get paid by the doctor. Now, I will tell you, and I know we're being recorded, but I went to Michael Shore, and I wanted him to help me spread the word because I was giving back to the community, mm-hmm. and he wanted to charge me a fortune for advertising. Mm-hmm. I was a small company. We still are a small company. I actually work for Taylor for free.
Okay.
We have employees that get paid. Mm-hmm. But I work for free. We do free cost analysis, apples to apples and apples to oranges. So, for example, let's say you're ordering all your stuff from Henry Schein. Mm-hmm. You can go to Henry Schein and you can do a printout on an Excel spreadsheet of your buying for a year, and you can give it to me, and I will do apples to apples, which means I match it product to product, except if you're using Henry Schein Band-Aids, I'm going to give you Medline Band-Aids, which, by the way, Medline's generic Band-Aid is Curade. You see it in every pharmacy that you go to. A Curade Band-Aid is Medline's generic.
Okay.
We have 33 different companies. We just signed a new contract with Cano Chairs. They're unbelievable for people, who want to get chairs. Mm-hmm. We can get you anything. You want to get X-ray machines, MRI, ultrasounds. I always tell people to check with us first. Mm-hmm. So if you're already ordering from Medline and you're not signed up as a Taylor member, mm-hmm. you're paying their full price.
Yeah, something that we didn't even know, and I bet you a lot of people that are listening, they don't even know that.
Well, we have ads every day on PM News, mm-hmm. just so you know. And actually, tomorrow night, if you're interested, every other Tuesday, we have what's called Taylor Tuesday. We do educational programs for everybody. We've been doing it since prior to COVID. Okay. All of them are archived. Last week was 2 weeks ago was Lowell Weil. I've had every big name, and I even when John said something, John actually sponsored the guy from Chicago. Mm-hmm. But I told him if he wanted to do something with you on PAD. I mean, we're looking, Don, to actually. The more we make, the more we want to give back to the podiatry profession. So, there's Doc Shop Pro.
Yep.
You've got Shine.
Mm-hmm.
You've got McKesson bought out more.
Mm-hmm.
So you have Shine, McKesson, Medline.
Okay.
What I've told people is aggregately. Aggregately. So what I'm going to tell you is we guarantee, and it may mean nothing to you,
Mm-hmm.
but we guarantee that if you take everything that you purchase from your vendors and you come to me, we guarantee a 7% aggregate savings. That means your staff isn't going to a million different places
Mm-hmm.
and looking. Now that's a guarantee of 7%. We're averaging between 20 and 30%
That's pretty
saving.
amazing.
And I mean, we source all of the products through different vendors. I'm not going to say that there hasn't been a difficult time during this COVID time with PPE and different things, but it is what it is. But we've done the best we can, and we've provided most people with what they need. I listen. I've had to go to black market distributors to get product.
Mm-hmm.
I mean, when people needed it, they needed it. But I think the whole we're built on very similar to what you're saying here. Is education. So on part of our website, we have something called Taylor University.
Mm-hmm.
Taylor University actually particularly talks about clinical conditions and what would be good clinical protocols to treat them, and the billing and coding corresponding with those clinical protocols.
Mm-hmm.
So, and we're always open. Look, I've had a couple of people who actually wrote something for me because they thought it was a good tool. And we when we started this, we have 157 investors,
Mm-hmm.
probably some of the biggest names in the profession. Mike Downey, Michelle Butterworth, Steve Corey, Mickey Stapp, I can't name all. Chris Reeves, Amber Shane. I mean, at the time when I started this, we just reached out to people that Jeff Lehrman, Mary Beth Crane, just people that, so we have 12 directors,
Mm-hmm.
and we have 157 investors. Every large super group in the country invested in Taylor Medical. So,
amazing.
Yeah. I mean, and the problem is, we are there are certain legal guidelines with GPOs
Mm-hmm.
as far as what percentage you can get. So I don't have the budget. I'm not Medline, which is my primary med surg company, but they're a $14 billion family held business.
Mm-hmm.
We have 5 employees. And we everything is virtual. We have a website, a portal. You can order off the portal. And I think that there are, a variety of different things, that we can do, and that there are things we can do better, and we're always striving to do better. But the whole goal was basing this concept on helping the profession. Yeah, I'm not going to say, listen, this is a business, just like ePresent is a business and everything else is a business. It's a business, but it's a business for me that I guess you've known me for quite some time, and I think that I joke around, and I've said this before, so it doesn't matter that we're recording this. I'm a black or white kind of guy. There's no in between. Either people love Ira Kraus or they don't love Ira Kraus. It's kind of not in between.
Yeah.
And for me and for Jeff, when we started this, this was a way of just giving more back to the community. I mean, not that it means anything, but I have a personal endowment to the Educational Foundation in the memory of my father.
Mm-hmm.
Jeff was instrumental in getting a personal endowment in the Orange County Podiatric Medical Society. So, they give something, but Taylor Medical has already given $50,000, which on an annuity gives away 4 $1,250 scholarships every year to students in need. And so our goal is the more we make, the more we want to put into promoting the profession.
That's great.
We are not, are you familiar with Ganef?
No.
Okay, Ganef is a Yiddish word. So I always get this backwards, but I think it's, pigs get fat, hogs get slaughtered. So a Ganef is a hog because they're going to get slaughtered. I don't have to make a penny on everything that I do.
Mm-hmm.
Yes, this is a business. I'm very happy if my employees get paid, if I could eventually pay back my investors, and I give money to the profession. That's kind of really what I'm trying to do. And I think that again, we need partners. So Medline is our big partner for our med surg supplies. And it's interesting. People are very funny. It's interesting how people like using name brand things. Again, you like I remember when I was in school, even when I was early in practice, everybody used to love that special Band-Aid. They had different shapes and they were elastic.
I forgot the name of it,
but you buy those Band-Aids and you could use a Curate fibroelastic Band-Aid and spend 40% less and get the same result. Yeah. And people want to use, the original Coban instead of the knockoffs. Maybe some of them don't stick as well. I'm not going to say that everything is perfect.
Yeah.
Knockoffs are a knockoff for a reason. They're a branded item, So they're a non-branded item. But we actually, when we do cost analyses, we show everybody what you can do on a quote generic. Like you don't have to get a BD needle all the time. You can get a Medline needle and save 40%. Again, it's just different.
Yeah, it sounds like the best thing for people that they're interested. They're just going to print off the list, have their office manager send it, and you do a comparison. That's great. Well, thank you so much, Ira. If people want to learn more about Taylor Med, is there a website they can go to learn more?
It's www.taylormedical.com.